Which of the following joints connects the shoulder girdle to the axial skeleton? A. Acromioclavicular joint. B. Sternoclavicular joint. C. Glenohumeral joint. D. Scapulothoracic joint. Answer: B. Sternoclavicular joint. Explanation: the sternoclavicular joint, SC joint, is the only direct bony connection between the shoulder girdle and the axial skeleton. It connects the sternal end of the clavicle with the manubrium of the sternum. The acromioclavicular joint is located between which two structures? A. Clavicle and acromion process of the scapula. B. Scapula and humerus. C. Sternum and clavicle. D. Scapula and rib. Answer: A. Clavicle and acromion process of the scapula. Explanation: the acromioclavicular AC joint is formed by the articulation between the acromion of the scapula and the acromial end of the clavicle. It is a synovial joint that allows for some degree of movement between the clavicle and scapula. The glenohumeral joint is a type of which kind of joint? A. Ball and socket joint. B. Hinge joint. C. Saddle joint. D. Pivot joint. Answer: A. Ball and socket joint. Explanation: the glenohumeral joint is a ball and socket joint, where the round head of the humerus fits into the shallow glenoid cavity of the scapula. This allows for a wide range of motion in multiple directions. Which ligament provides the primary stability to the acromioclavicular joint? A. Corticoclavicular ligament. B. Acromioclavicular ligament. C. Glenohumeral ligament. D. Costoclavicular ligament. Answer: B. Acromioclavicular ligament. Explanation: the acromioclavicular ligament stabilizes the acromioclavicular joint by connecting the acromion to the acromial end of the clavicle. It helps prevent dislocation of the joint. The corticoclavicular ligament connects the clavicle to which structure? A. Acromion. B. Coracoid process of the scapula. C. Sternum. D. Rib. Answer: B. Coracoid process of the scapula. Explanation: the corticoclavicular ligament connects the clavicle to the coracoid process of the scapula. It consists of two parts, the conoid ligament and the trapezoid ligament, and plays a crucial role in stabilizing the acromioclavicular joint. Which of the following movements is allowed by the sternoclavicular joint? A. Flexion and extension. B. Abduction and adduction. C. Elevation, depression, and rotation. D. Medial and lateral rotation. Answer: C. Elevation, depression, and rotation. Explanation: the sternoclavicular joint allows for elevation, depression, protraction, retraction, and limited rotation of the clavicle, facilitating movement of shoulder girdle. The scapulothoracic joint is considered a functional joint because A. It is a true synovial joint. B. It has a bony articulation between the scapula and the thoracic cage. C. It involves the movement of the scapula on the thoracic wall. D. It is stabilized by ligaments only. Answer: C. It involves movement of scapula on thoracic wall. Explanation: the scapulothoracic joint is not a true anatomical joint since there is no direct bony articulation between the scapula and the thoracic cage. Instead, it is a functional joint formed by the movement of the scapula over the rib cage. What is the primary function of rotator cuff muscles in relation to glenohumeral joint? A. To facilitate movement of scapula. B. To stabilize shoulder joint and enable rotational movements. C. To elevate the clavicle. D. To assist with elbow flexion. Answer: B. To stabilize shoulder joint and enable rotational movements. Explanation: the rotator cuff muscles, which include the supraspinatus, infraspinatus, teres minor, and subscapularis, play a critical role in stabilizing glenohumeral joint and allowing for rotational movements of shoulder. Which of the following movements primarily occurs at the glenohumeral joint? A. Shoulder adduction. B. Shoulder abduction. C. Lateral rotation. D. All of the above. Answer: D. All of the above. Explanation: the the glenohumeral joint allows for a wide range of movements, including shoulder adduction, abduction, flexion, extension, medial and lateral rotation, and circumduction, due to its ball and socket configuration. Which joint is responsible for the upward and downward rotation of the scapula? A. Sternoclavicular joint. B. Acromioclavicular joint. C. Glenohumeral joint. D. Scapulothoracic joint. Answer: D. Scapulothoracic joint. Explanation: the scapulothoracic joint, although not a true anatomical joint, is responsible for movements like upward and downward rotation of the scapula. This motion is essential for overhead arm movements, such as lifting. The glenoid labrum of the glenohumeral joint. A. Enhances the stability of the joint. B. Provides attachment for the biceps tendon. C. Helps in the movement of the scapula. D. Is a ligament connecting the humerus to the scapula. Answer: A. Enhances the stability of the joint. Explanation: the glenoid labrum is a fibrocartilaginous structure that deepens the glenoid cavity and enhances the stability of the glenohumeral joint by increasing the surface area for the humeral head to articulate with the scapula. The acromioclavicular (AC) joint is stabilized by all of the following ligaments except: A. Acromioclavicular ligament. B. Corticoclavicular ligament. C. Glenohumeral ligament. D. Coracoacromial ligament. Answer: C. Glenohumeral ligament. Explanation: the glenohumeral ligament stabilizes the glenohumeral joint, not the acromioclavicular joint. The AC joint is stabilized by the acromioclavicular ligament and the corticoclavicular ligament, along with the coracoacromial ligament. The coracoid process of the scapula provides attachment for which of the following muscles? A. Pectoralis major. B. Trapezius. C. Biceps brachii. D. Deltoid. Answer: C. Biceps brachii. Explanation: the coracoid process of the scapula provides attachment for the short head of the biceps brachii muscle, as well as other muscles such as the coracobrachialis and the pectoralis minor. The acromioclavicular joint allows for what type of movement? A. Flexion and extension. B. Lateral and medial rotation. C. Gliding movement. D. Circumduction. Answer: C. Gliding movement. Explanation: the acromioclavicular joint is a synovial joint that primarily allows gliding movements between the acromion of the scapula and the acromial end of the clavicle. It helps in shoulder movements, especially during arm elevation. What type of joint is the glenohumeral joint? A. Ball and socket joint. B. Hinge joint. C. Saddle joint. D. Condyloid joint. Answer: A. Ball and socket joint. Explanation: the glenohumeral joint is a ball and socket synovial joint, where the head of the humerus fits into the shallow glenoid cavity of the scapula, providing a wide range of motion in the shoulder. Which of the following muscles is responsible for stabilizing the shoulder joint by holding the humeral head in the glenoid cavity? A. Supraspinatus. B. Subscapularis. C. Deltoid. D. Rotator cuff muscles. Answer: D. Rotator cuff muscles. Explanation: the rotator cuff muscles supraspinatus, infraspinatus, teres minor, and subscapularis play a vital role in stabilizing the glenohumeral joint by holding the head of the humerus within the shallow glenoid cavity. The scapulothoracic joint is described as a functional joint because: A. It involves direct bone-to-bone contact. B. The scapula moves along the thoracic cage, allowing movement. C. It is a ball and socket joint. D. It is a hinge joint. Answer: B. The scapula moves along the thoracic cage, allowing movement. Explanation: the scapulothoracic joint is a functional joint, meaning it doesn't have a direct bony articulation but instead involves the movement of the scapula on the thoracic wall, contributing to shoulder mobility. Which of the following movements is most associated with the acromioclavicular joint? A. Shoulder abduction. B. Shoulder adduction. C. Scapular elevation and depression. D. Scapular protraction and retraction. Answer: C. Scapular elevation and depression. Explanation: the acromioclavicular joint plays a role in the movement of the scapula, allowing for small adjustments during scapular elevation and depression. It helps facilitate the upward and downward motion of the scapula as the arm moves. Which ligament connects the clavicle to the first rib? A. Corticoclavicular ligament. B. Costoclavicular ligament. C. Acromioclavicular ligament. D. Sternoclavicular ligament. Answer: B. Costoclavicular ligament. Explanation: the costoclavicular ligament connects the clavicle to the first rib. It is an important stabilizing ligament of the sternoclavicular joint and helps prevent excessive movement of the clavicle during shoulder movements. Which structure is not part of the shoulder girdle joints? A. Sternoclavicular joint. B. Acromioclavicular joint. C. Glenohumeral joint. D. Radiocarpal joint. Answer: D. Radiocarpal joint. Explanation: the radiocarpal joint is located in the wrist, not the shoulder girdle. The shoulder girdle consists of the sternoclavicular, acromioclavicular, and glenohumeral joints, along with the scapulothoracic joint.